So in today's Dr. Alex Answers video, I just want to talk a little bit about homeopathy and natural remedies or dietary supplements in pets, so stay tuned. Hi, I'm Dr. Alex, the veterinarian behind ourpetshealth.com, where my aim is to help you and your pet to live a healthier, happier life. So make sure you're subscribed if that's something you're interested in. And in my Dr. Alex Answers series, I take one of your questions and try and give you the information that you need. And today's question comes from Lilia, who's a fantastic subscriber and has been commenting and discussing with me a lot of kind of different points on lots of my different videos. So yeah, today's question was asked by Lilia, and she watched my video that's all about natural supplements, dietary supplements, and comparing those to drugs. So trying to decide, you know, which is best, what's the difference, which is the most appropriate one for your pet. Well, where does homeopathy fit into that? Is homeopathy a natural product? Can it be thought of as a natural product or a dietary supplement? And the answer really in my mind is no, they're completely different. So when I think of a dietary supplement or a natural product, I'm kind of mainly thinking about a product that actually has got an active ingredient in it that does theoretically have an action on a body system. So that could be, you know, any number of things. Obviously a lot of our drugs, or really all of our drugs, come from originally from natural products. So that could be aspirin, which I think comes from a tree bark, if memory serves me right. But what we've done is we've isolated that individual component of the tree bark to produce the aspirin that we know and that we take, you know, many times, you know, a week, a month, or whatever, you know, depending on your situation. So that's something, you know, we could instead give tree bark. It's not as effective, or it's going to be difficult maybe to get the kind of an effective dose, but we could give that, and we could expect that to potentially have an action. The same would be if we, you know, eat lots of fish. We expect to get a lot of our essential fatty acids, so our omega-3 and our omega-6 essential fatty acids, or omega-3 mainly for fish, and we could actually expect that, and we could then expect that to have an effect that we know when we purify and we take actually essential fatty acid supplements, that they potentially have a benefit. So if that makes sense, we can expect something to have an effect. Now, when it comes to homeopathy, there is really, and if you've seen my videos on homeopathy, you'll know my thoughts on this, but there is no theoretical reason that we can expect what is effectively water to have an effect on different body systems depending on what substance has been infinitesimally diluted in it. The idea with homeopathy is that you take a substance, often it's actually something, a part of whatever is causing that disease. You're then putting it in a little bit of water, you're bashing that water against a leather strap or something to impart the energy from that substance into the water, and you're then taking a tiny amount of that water and diluting it into more pure water, and so on for lots of different times, often 30 times. So 30C means that there's been 30 dilutions, and that's quite a common one, I believe. Excuse me. And statistically, there is, you know, actually none of that original particle, original substance in the homeopathic substance. So how can that possibly be expected to have a result? That, you know, effectively it's a belief. It's you know, something that if you think about it logically through that description, there's no way that can have an effect. There's no explanation for that. Now, whether you kind of believe in homeopathy or not, and if you do, you've probably stopped watching by now, but that's very different from a natural substance where I would expect, you know, there to be a theoretical benefit. So something that we're seeing a lot at the moment is curcumin supplementation. So that comes from a natural source. The problem being, and we know that when that is in a concentrated form and we're getting a reasonable dose, then that potentially has an effect, or it has an effect in the lab on kind of cells that are grown in a petri dish. The problem being though is when we take the natural substances that contain that ingredient, we would actually need a ridiculously large amount to get the dose that we need. So while you could potentially expect that there might be a benefit from taking those supplements, if we break it down, the likelihood of that benefit is actually potentially pretty unlikely. You know, that's not going to be the same for everything. I guess we would think of herbal medication is very much the same. So herbal medication would be a natural product, a natural supplement, a natural dietary supplement, or a natural medication, you know, whatever the words you want to use. Again, it may have that active ingredient, but whether it has it in the right concentration or not, or whether there are other things within that natural product that may actually increase the risk of side effects developing, because you may have kind of different chemicals competing with each other. I guess an example of that would be cannabis. So something, you know, CBD oil is something that is you know, gaining popularity, and that can definitely be thought of as a natural medication, a natural product, or a dietary supplement to use to treat arthritis or epilepsy potentially, or anxiety. But if you just took it from the gave cannabis, then that also has the THC, which is the psychoactive compound. So while you might get the benefit of CBD, you'll also get the downside of the THC, and that in extreme circumstances can, you know, be really dangerous, although by and large marijuana is something that is pretty safe, and I've certainly discussed that in a couple of other videos about both of those topics. So yeah, I hope that answers your question. I hope that's kind of made things a little bit clearer and not kind of complicated matters. Yeah, I hope it's not kind of too much of a rant or anything for you, but you know, that's my thoughts really on where, you know, homeopathy and maybe a lot of these other kind of alternative remedies come in. You know, they maybe not have much evidence behind them. There's maybe no theoretical way that you can link the supposed effect they have on the body system that they're supposed to be affecting. And also often with, sorry, we've got my cat here. So normally I shut my cats out when I'm filming, but Molly has just come to join me, and you might have heard her meowing earlier. She's wondering what's going on and why she's being picked up and shown to the camera and she can see herself. Anyway, there we go, good. The other thing Lilia mentioned was about using kind of natural supplements or dietary supplements. You know, should you use them instead of drugs, or is it part of a combination? And I guess generally, in the vast majority of cases, if we're going to use them at all, if we're going to try them, we should definitely think of them as complementary to other things that we can do. So that's not always drugs. That could be, in the case of arthritis, we might give a glucosamine and chondroitin or a green lip mussel extract. We might start giving fish oils, or we might feed a specific joint diet, but we don't want to do that in isolation. At the same time, we want to control exercise. We want to think about modifying one of our pet's environment, so soft bed, keeping them out of a draft, reducing the risk of them falling over on slippery floors, so putting down rugs and mats and that kind of thing. So we want to think of a lot of diseases, we want to think of that as just one part of a treatment strategy. Anyway, that's it from me. Those are my thoughts. It's getting late and I don't want to ramble on too long, but yeah, I hope that answers your question, Lilia. If not, you can always leave me a comment down below and I'll try and answer that a little bit better. But also, if you've got a question like Lilia, you can just ask me you know, over on my website. If you follow the link, and I'll leave that in the description, then I'll do my best to get you the information that you need as well. Make sure you're subscribed if you're interested in videos like this. Give it a thumbs up if you've enjoyed it. And until next time, I'm Dr. Alex from Our Pets Health, and this is the show where you ask the questions and Dr. Alex answers.